Today to come here, obviously, you all know this is a very important issue, and I think all of us are our own way. The organization you're with is trying to address the opioid addiction in each organization here. And before I introduce our guest speaker today, one of the things we've been working on is a program here in Cape Coral that we can get all these organizations together to identify the resources that we have available to us. The more I've gone around and talked about the opioid addiction, different meetings I've been to, even when I Park Royal a couple weeks ago, I've learned there's so many organizations out there that I've never heard of that can provide resources that I didn't know were even available to us. So one of the important things we want to do, we're trying to do here at the police department, is develop a policy and procedure that if somebody comes to our department in need of help, we can provide assistance immediately. We can't turn them away and go, well, come back next week, I can't find you inpatient, outpatient care, I can't find you counseling. We don't have it right now. And that's a problem that we're trying to all fix at this time. So by developing a resource guide, that's one of the reasons why when you came here today, there's a form that you get filled out so we can identify who are you, what organization are you with, and what service can you provide. And we're going to take that information and we're going to put it into a resource guide as part of our policy that we will share with everybody. And we're going to continue to add that resource guide as we continue to meet other organizations that are available to us in the area. So again, when somebody comes to ask for assistance at the police department, we want them, number one, we want them to feel welcome to come to the department, number one. That's the most important thing. We want them to know that we want to provide them service. I think we all can agree, at least from our standpoint, that just by arresting a person in possession is not going to fix the problem. Recidivism is not going to fix the problem. So we have to come up with a different solution. What we're doing now is not working. So that's why we're here today to put a program together and we all can utilize a resource guide to identify what resources are out there. And I asked, Justin Kunzelman is going to be our speaker today. I met Justin about 2 years ago at a police chiefs conference in Orlando. And Justin comes from the West Coast in Palm Beach. I'm going to read his bio in a minute here, give you a little bit of his background. But he started a program called Rebel Recovery and talks about his personal experiences that he went through himself, what they've done over in the West Coast or the East Coast to address the addiction over there, and how far they've come. There's so many programs out there. We don't obviously have to reinvent the wheel. We can look at the programs that have worked, the things that have not worked, take the good things, put those together in a program here, and grow from there. And that's why we're here today. Justin is again from Palm Beach County. He's a Palm Beach County native. He has an associate's degree in social work from Palm Beach State College, where he was a member of the Phi Theta Kappa Honor Society. Justin is also the co-founder and CEO of Rebel Recovery, which is the first and only harm reduction nonprofit agency in South Florida. Rebel Recovery is responsible for all naloxone, Narcan training for individuals, substance abuse facilities, and recovery residences in the South Florida area, as well as the distribution of sterile supplies and used syringe disposal. Rebel Recovery maintains working agreements to provide certified peer recovery support services to indigent and low-income individuals, helping people identify and navigate community resources needed to improve their quality of life. Justin is on the front lines of the effort to bring much-needed syringe exchange programs to Palm Beach County. He has a passion for helping his community and working to bring effective change to the public health system. Through his vigorous advocacy work, Justin has accepted and maintained seats on the Palm Beach County Substance Awareness Coalition, Palm Beach County Reentry Task Force, Palm Beach State College Human Services Business Advisory Council, the state's Attorney Sober Home Task Force, and Palm Beach County Heroin Task Force. Justin is a valued contributor to WPTV, CBS affiliates, the Palm Beach Post, as well as the Sun Sentinel on issues surrounding drug use in our local communities. He was a nominee for the 2016 PBC SAC Community Champion Award and a recipient in 2017. Above all these accomplishments, Justin states his most valued is his marriage to his wife Allegra and his sons Kaleo and his newly born Mikoa just a few months ago. So with that, Justin, would you please come up? Please welcome Justin.
in the actor studio. How you doing? Thanks for coming out and for inviting me over to speak. I'm going to disappoint all of you. The chief called me to ask me if I would come help. I was a little taken back that the police chief of an area would be the person to reach out and say that they wanted to try to figure out something different because what they were doing wasn't working. You guys are very blessed to have a police department that is that engaged in the community. Not all of us have law enforcement that is willing participants in these types of programs or interventions. We have, in all of our accomplishments in Palm Beach County, the one thing that we've never been able to do is actually maintain working agreements with our police departments and our sheriff's departments and things like that. You guys have a very positive thing here, that your community seems to be, although it's a lot bigger than I thought it was. I didn't realize it was as big as it is. It appears to be pretty close-knit as far as it doesn't feel like big city, you know what I mean? This is the biggest church that I've ever been in, though. Y'all got like video games and stuff. We just had them hard, like wooden pews when I was growing up in Lewiston. We face. I'm imagining a lot of the same issues from community to community in the state of Florida. And something that's important to understand about the state of Florida, as far as the national scope of this issue, is that the state of Florida in general is 50 years behind the rest of the country, save for maybe Indiana, North Dakota, probably like Butte, Montana might be a little farther behind than Florida is, but not by much. Our legislation regarding issues surrounding recovery support and the need to support people who use drugs has been non-existent for the last 10 years. A lot of strategies that have been implemented in other areas to kind of curb this issue that Florida is seeing now, where we have this sharp increase of overdose deaths, we have tainted drug supplies. A lot of those issues have been curbed in other areas by implementing strategies that Florida is just now starting to look at. It can be a very positive thing for Florida, though, for Florida communities, because what we have is that other people have already made a lot of mistakes. We do not, my mama taught me this when I was really young, you ain't got to learn from your own mistakes. You understand? It is possible to learn from other people's mistakes. And that's something that Florida really gets to do, is that a lot of other communities around the country have identified programs that they've started, they've failed, they've rebuilt, they've restructured, and now they are fully operational. They have policies and procedures, they have budgets, they are plug and play ready to go in other communities. And we have the benefit of being able to take a lot of those things and look at them when we're looking at the problems that exist in our own communities. It's important, at least for us, it was important to understand that every community is not the same. Every community does not face the same struggles as far as drug use and recovery and mental health. Different communities require different services. Different communities require different programs to operate. There are a lot of programs that agencies like Rebel Recoveries are doing around the country that Rebel Recovery is not going to do because they don't make sense within the perspective of what our community needs. It would be a wasted resource, right? It would just be doing things to be doing things. So one of the most important things I think that we did when we started looking at our community is really identify the people in the community who had some idea of what services would be needed. The first step to solving any problem is to identify a problem, right? And while it could seem very, on the front end, it can seem very obvious what the problem might be when we see overdose numbers in the multiple thousands throughout the state. When we see an increase in tainted drug supply, these things can seem very on the surface. Well, we know what the problem is. We have to stop drugs, and we have to stop people from using drugs, right? When in reality, if we really dig into the micro level of what are causing those issues, those things can be turned around, which we've shown in Palm Beach County through very much smaller, much more cost-efficient actions. Instead of focusing on how do we keep people from doing drugs, instead we focused on, you guys are probably going to do drugs, right? We're going to flood the streets with naloxone. We cut, Rebel Recovery distributed 5,000 doses or kits of naloxone. That's 10,000 doses in the Palm Beach County last year. Palm Beach County experienced 356 overdoses for 2017 to 2018. It was down 42%. Rebel Recovery reported 374 saves from our naloxone distribution program. That is no officers required. That's no EMS required. No extra work was required except to educate somebody on what naloxone does, how to use it, and give it to them. People in our community reversed 354 overdoses by themselves, just through a 5-minute education. The total program cost us $160,000 to buy the naloxone that the state paid for. There are solutions that exist that are not obvious at first glance, and they're not intuitive because they go against a lot of stuff that we've been taught for so long. For the last 100 years, we've been taught that people who use drugs are bad. People who use drugs have morally failed. I was not raised to believe anything different. But what happened as a direct result of my own drug use is that now I have to experience the shame and stigma that come from believing that I'm a bad person. For the simple act of trying to change the way that I felt, because I naturally am not able to feel the way that you feel by myself, right? I've developed that ability, but it's taken me 10 years. See what I'm saying? It's taken me 10 years and a 3-year-old to understand who I was. Because nobody will test you like a 3-year-old. I thought I was fearless when I was 16. My 3-year-old is not scared of nothing. But we've been taught to hold certain beliefs about people who use drugs. And on the surface, it can seem like such a meaningless thing to have to unpack our beliefs and our inherent biases against people who use drugs. But it is important, right? It's important to understand our own internal biases against the people that we're saying we want to help. Is the intent for us to help the individual, or is the intent for us to make sure the individual doesn't do drugs? We have to pick. We have to pick. I'm not saying that recovery is not possible in helping somebody. Please don't misunderstand what I'm saying. I'm in recovery myself. I've been in recovery for the last 10 years. I know it's possible. But what I'm saying is that identifying the difference in what we're trying to do, what is the purpose, what is the goal, is very important to understand how we get there, right? a community-based recovery organization has a very different goal than a community-based peer support organization, right? A community-based peer support organization like Rebel Recovery, our interests are in getting the person the access to the services that they need at any given time, as they stand in front of us right now, regardless of what those services are. If it's food stamps, then we want to help them get food stamps. If it's stable housing, we want to help them get stable housing. But it is always participant-led. The engagement is always participant-led of what do you need? I don't want to tell you what you need. I want you to tell me what do you need? How can I be of help to you as you stand in front of me right now? What is the biggest impact that I can make in your life to make a positive change? Right? The same thing that I would do for a friend. If a friend called you and said, hey, I'm struggling, right? Would you make assumptions over what they need? Definitely not. You'd be a bad friend. Your first thought would be, are you okay? How can I help? So why is it different for members of our community who use drugs? As a provider, that's my job. My job as a provider is to show compassion, care, understanding, concern, and empathy. At all times to show unconditional love. That is my job as a community member. I leave my house every day. I have to look my children and my wife in the eyes and be satisfied that when I go out into my community that I've been the best member of my community that I could have possibly been that day, because that's what I expect from my children, right? Y'all got children? A lot of you? Ain't that what y'all expect from your kids? The only thing you could ever hope your kids do is be a positive, upstanding member of their community, right? That's what we tell them from the time they're babies, to share your toys, stop hitting, all that stuff is just so that they can be a positive member of their community and an upstanding citizen. That's what we want, right? We have to exhibit that behavior. Regardless of whatever the actions of the individual are. Something that I learned from, I talk about my kid a lot. He teaches me a lesson every day. Something I learned from my 3-year-old is that you cannot respond to wild behavior with wild behavior. You understand? Like the first time I'll never forget the first time my son slapped me in the face. And I was like I lost it. You know what I mean? I was really angry. I'd never been slapped in the face before. And I slapped his hand and I was like, absolutely not. He slapped me again. It was then that I learned. Maybe if you don't slap him, he won't do that. You know what I mean? Maybe calm and gentle and just say, hey, that's not something that we do. I don't appreciate that. You know what I mean? We need to take the time out. But those things they tend to go away when we get into talks about how the community can serve people who use drugs, because people who use drugs are a scourge on the community, right? Because we've been told that for the last 50 years. Anybody who went to school here for the last 50 years has been told that people who use drugs are a scourge on the community. They ain't good for nothing. They ain't never been good for nothing. Drugs ain't good for nothing. They're bad for you. They'll kill you. We've had all these negative messages about drugs. And I'm here to tell you that they are all lies. I am not saying that there are not negative consequences to drugs. I am not saying that there are not very real negative health consequences for people who use drugs. But what I am telling you is that simply the act of taking a substance and putting it in your body to change the way that you think or feel is something that every single person in this room does every day, I promise you. Y'all drink coffee? How many of y'all drink coffee for the taste? Please lie to me. You don't put no sugar in your coffee? I'm old school. Was it always that way though? The first time you drank coffee, you liked it, just black? Right. You had to change the taste, right? Because caffeine is used for an effect. It's used for a positive effect, right? You know what one of my favorite drugs is? Sugar. Yeah, I wait till my whole house is asleep, and I will slam 3 candy bars and a 3-pack of cookies from 7-Eleven. Because sugar makes me feel good. Anybody smoke? The only one. My point being is that the simple act of taking something and put it into your body to change the way that you think, feel, or view the world is not an inherently bad trait. And we have to stop believing that it is, or we are always going to treat people who use drugs, who require our assistance, differently. We are always going to treat them with stigma and resentment, and they identify that, right? They know. When you approach somebody with your own personal set of stigmatizing beliefs, I know when I walk, I know what I look like. I don't always wear shirts like this. I did this because I'm trying to be more professional. I don't think I'm doing it right, but I'm trying. But like I know what I look like when I have my hair down and I'm in a tank top and you can see all my tattoos. I get stopped at the airport every time I travel for random screenings. But I can also tell when people have judgments on me when I walk into a room, right? So can people that use drugs, people who require services. And I don't want to harp on it too long. I just really wanted to let you know that as you start discussions for what's appropriate for a community, please keep that in the forefront of your mind, that those things are important to understand. And I'm not saying that if you have those beliefs or you have those thoughts that you're a bad person. That would be silly. But I am saying that it's important to look at them and understand them. It's important in any time that you are engaging with diverse populations, which drug users are a diverse population. It is really important to understand the way that we, like our misheld beliefs, right? So that we can identify and be upfront with them and then work through them. It's also important because as you look to build out programs, it's important to remain very objective about the programs that we're looking to build and look at programs that have data to support them, programs that have shown positive results in other communities. A lot of communities fail at their approach to responding to any type of drug crisis because they let their personal beliefs override what the data is saying. And it's important that we understand that we cannot do that. As professionals, I assume that some of you work in this field now. And as professionals, our duty is to disseminate factual information to our participants, right? That is our job. And sometimes that stuff gets very skewed when large groups of individuals come together with many different ideas over what will solve certain issues. Seems to be this very siloed approach across the state, where everybody is in their own separate lane doing their own separate thing, and nobody is interconnected and talking to each other. It's called a network of care for a reason. And one of the best things that we ever did in Palm Beach County was take the initiative as an agency to try to make those connections between agencies who were doing work that directly benefited our participants. So when an individual comes to us and through any avenue, through our hospital overdose program, through a referral from another provider, through a walk-in, through just calling the phone line, as we identify what services are needed for this individual, where they're most highly impacted, it's important to understand what agencies provide other services that are going to impact the same population. Because, like you heard the chief talk about, it's important that we have resources available when the person calls, right? it's like a no wrong door policy. Is another very important systematic issue that needs to be addressed. Is low barriers and no wrong door. That if I need access to services for homelessness because I'm experiencing homelessness, and I walk into the police station and say, I would like services for drug addiction as well, right? I'm homeless and I'm using heroin and I want help. And we have a program that the police take me now to maybe a peer resource center or an RCO or a treatment facility. That what am I going to do when I leave the treatment facility and the treatment facility doesn't have any connection to my local homeless resource center and no referrals been made? And it's important to understand, because at the treatment center I'm going to say, hey, I'm homeless and I really need to talk to somebody about where I'm going to go when I leave here. And coming from Palm Beach County, the private treatment industry is going to tell you, you don't need to worry about that right now. We need to just focus on getting the group. We need to focus on what the real problem is. You know what the real problem is? You use drugs. That's a problem. And I'm like, I don't know if anybody in this room has been homeless. I have. I assure you that drugs were not my problem when I was homeless. Being homeless on the streets of Lake Worth, Florida, in 100-degree heat in August was a problem, right? It was not the amount of alcohol that was in my system that was a problem to me at that point. It's important to listen to the population of people you are serving. People who use drugs and people who experience overdose in their community, people who have had recidivism of arrest and have been through the system constantly. If you listen, they will tell you what they're missing. They will tell you what they need, but they need to have an environment where they feel safe to do that. And treatment systems have not traditionally been the environments to build that kind of trust. Speaking as a former treatment professionals, we have traditionally abandoned participants in their time of need, right? The putative system of discharging people when they relapse is insane. It's not necessary. It's abandonment. And it's something that happens all too often, that we take individuals who have been on the street for, say, 5 years, right? And have been using drugs and had recidivism of arrest frequently for nuisance problems, public drunkenness, possession, theft, petty theft, you name it. And we get them into a treatment system. And we put them in IOP. And they're in a halfway house. And the first thing they do when they get uncomfortable is go drink. And then we discharge them to nowhere. These are things that are important to understand. If you don't understand how the treatment system works a lot of times, it's important that you reach out and understand how the treatment system works. Because just calling for more beds or saying that building more facilities or that getting access to more money for treatment is going to solve the problem is not going to solve the systematic problems that already exist. We have systemic problems within our community, and until we are willing to address the systemic issues and really take honest looks at ourselves as community members and what we're responsible for in our separate siloed agencies, we're never going to make progress. So as you guys start this, please learn from our mistakes. Please learn from a system that was inherently broken when we got there and remains very broken. We have made huge, huge leaps forward in Palm Beach County. But it is because we have identified barriers that existed and removed them. And it's because we have advocated to listen to people who actively use drugs. Pay them for their time. It's okay to pay somebody if you know they're using drugs. I promise Jesus is not going to turn away from you if you give somebody who uses drugs money. It's okay. He probably would have done it himself, right? But we have to look at creative solutions to identify the problems that exist, what barriers exist in our communities, where everybody who needs to be at the table is at the table, and you can create a very smooth system where we can tear down silos of different community providers and really interconnect. People need a community-based wraparound service support model. We need ROSC framework to look at participant-driven data. We need participant-driven services. We have to study the data that's coming from these types of programs to identify what is working, what isn't working. Because for the last 100 years, all we've done is use word of mouth to say how successful certain programs have been, right? The most successful or long-standing systems that exist in the United States have no data to support them, right? Think about that. What is the number one thing that all of you would do if somebody in your family called and said, I have a drug problem? Would you send them to treatment? Or try? Raise your hand if you would send them to treatment. The treatment industry has no national standards. There is not one single standard nationwide for what treatment for substance abuse disorder looks like or should look like. Florida just reopened what their treatment standards look like and how they should be measured for the first time in 20 years. Think about what you were doing 20 years ago. 20 years. It's a long time for science to not look at new evidence-based models of what's effective. And these are barriers that are inherent in every system, in every community. The reason I highlight them is because they exist here. They're known to exist in every community, and they are the barriers that were the hardest for us to get over. They are the barriers that we're still systematically fighting right now to try to provide adequate services to the people who need services. Recovery support services go far beyond just supporting the people that it's easy to support. Everybody loves a feel-good story. If I sit here and I tell you I was homeless in Lake Worth, now I'm a CEO, I have my own house, I have a wife and 2 children, and I'm living my wildest dreams because of recovery, that's an easy story. It's easy, right? It's easy for me to find services. I could come to any one of y'all and say, hey, I'm struggling a little bit with this, and I've been in recovery for a little while, and I need some support. And any one of you would absolutely give me support, because I'm a miracle, right? I'm a miracle. I should be dead. But what we don't think about are the people who are still struggling and actively using, and what type of support they may need, because we've been taught tough love for so long that it's just become a part of our culture. I'm here to tell you that this data does not support those attitudes towards people who use drugs. We understand that love, compassion, empathy, and understanding, those are the things that are going to drive change for people who use drugs. When we come together as a community and we find out what's really important for our community, is it important for our community to help people make positive changes in their life, no matter how big or small? Or is it really important for us that they stay abstinent 100% from the time that they enter treatment for the rest of their life? Because it feels that way sometimes. Strictly speaking, as a person who uses drugs now and not as a CEO of an agency, sometimes it really feels like if I don't do it the first time, forever, that it's not good. It's not good enough. If I go 6 months without drinking and then I have 1 beer, and I'm told, threw it all away. Threw what away? That's the first time I ever went 6 months without drinking. Right? progress. That is positive momentum. It's a very difficult thing to try to address in communities, because there are so many different providers of different services, and people who use drugs touch a lot of different agencies before their cycle through the system is done. I did not realize how many agencies we actually touched until I became a provider and had to work with every other agency in our area, and realized that I had been to every one of them. I was a participant. I have to sit with CEOs and they're like explaining their program, and I'm like, no, I know. No, I know. You guys bought me groceries for the first 30 days I was sober. I know what that program does. I was a participant here. And the reason that it's important to try to understand that, and I'm sorry if I'm being too preachy, just say shut up if I am. I'm not trying to come off like that at all. But the reason I bring up how many systems one person who uses drugs touches is because that impacts the entire community. It impacts the taxpayers, it impacts our budgets, it impacts our agencies, the agency's capacity, it impacts your health insurance rates, it impacts your deductible rates, it impacts the rate at which our police and fire departments are able to respond to communities, to emergencies in our community. It impacts the rate at which I'm able to get services for my children, or you for your grandparents, or yourself. These are things that have a large collateral impact on our community as a whole, and we don't look at it that way a lot of times, but it's time that we start. Because if I can prevent one person who is actively using drugs or who is seeking recovery from accessing 5 or 6 different agencies by just realizing that I'm in a position to provide some of those services myself, that has an impact. That's 5 more slots that are open for individuals who solely need that one service, or who may only need 2 of those services outside of the service I'm providing. And as we really start to look at how you're going to build out a system of care and get as you're building your resource list, identify the agencies who are providing a lot of the same services, and make sure that you're utilizing that to the best of its ability. I think it's really important to reach out to all of the different members of communities who are dealing with this issue in some way or another, including hospitals, emergency departments, recovery. The local recovery groups should have representatives for your region, and having them come and be a part of things, and really identifying the ways in which mapping out the process for a participant. Map it out, put it on paper. What does the system look like for a 35-year-old who is addicted to opiates and homeless? What does that process look like for them to go from actively using and homeless to homeownership, say, stable housing, whatever wellness? We have 8 dimensions of wellness that are given to us by SAMHSA, and that's how we measure in Palm Beach County. That's how we measure our effectiveness as an agency, is how we're doing those 8 dimensions of wellness. So how do I get somebody from on the streets actively using drugs to positive numbers in those 8 dimensions of wellness, and what does that journey look like for them? And really identifying the participant journey in our systems of care, because it'll show us where roadblocks exist, it'll show us where navigational problems exist, it'll show us where staffing problems exist. I feel like I've taken up way too much time. Does anybody have any questions? Yes, ma'am.
How exactly do you fund your double recovery that you have? There's some
So-
people that are indigent, they're homeless, they don't have any funding. How do you get them into a recovery system if that's what they want, if they have no means of paying for it?
So we don't charge for our services. We're funded through DCF, through our managing entity for peer recovery support services. So we operate as a recovery community organization that's fully funded, and then we made a commitment when we first started that we would never charge anybody for our services. I'll stop providing services before I charge somebody for their services. Because in a moment of saying, if you need help, come to me, then saying, I need $5 for a processing fee, is a really sucky thing to do. Like, they're just not, it puts up a barrier, right, needlessly. But funding, state and federal funding exists to provide support to communities who are looking to do recovery community organizations. It's just a matter of identifying the funding that's out there and whether an agency in your area meets that description to provide those services, if it's appropriate or not. Yes, sir.
As your recovering population trickles through the system, a lot of them invariably end up incarcerated. Does Palm Beach County Sheriff's Office partner with you guys for the mission?
No. We have some connection to that population, definitely not through the Sheriff's Office. So we are actually, I'm driving back to Palm Beach. I was gonna stay with my wife because you guys have such a nice town, but I'm actually driving back to have a meeting in the morning with the medical director of our county jail and the warden of our county jail to implement a buprenorphine induction program and peer support program in the jail for people who are serving time about to be released or are just in on drug charges. And we're trying to actively move that population away from the county jail because, honestly, it's something that seems so intuitive that, of course, we would spend way too much money incarcerating low-level drug possession charges, but until you do the research on it, you don't really see how much money it actually is. But it's a huge, huge amount of cost savings to the county itself, let alone if you have a city jail. So those are things that we're doing, but we have implemented, we've proposed other programs, but this is what they gave us, and we're going to take it because it's fantastic. We are in drug court.
You mentioned something about the syringe exchange program. Do you facilitate that in your county? And could you talk to how you were able to get that accepted in the community and how effective it's been?
Is anybody in here law enforcement from Palm Beach County? Great. Technically, no, I don't run a syringe exchange. Rebel Recovery doesn't run a syringe exchange. We have volunteers that we facilitate a syringe exchange, if that makes sense. It's not run by Rebel Recovery. You can't walk into Rebel Recovery's office because they're illegal in Florida, except in Miami. We do a syringe disposal program, and we've probably taken back 3,000 plus syringes in the time that we've operated of just used syringes that would have been just out in the community. We do a lot of sterile supply distribution with our peers. So we have we have outreach. So part of our peers' time is spent doing outreach, which can be anything from it being in the parks with people experiencing homelessness to being in certain neighborhoods, talking to people using drugs there about testing their drug supply, the importance of knowing what they're doing, the importance of Narcan, to wellness checks of people we know in the community that have expressed to us that they're not ready to stop using drugs, but that they'd like us to come by and check on them every now and then and talk to them. Sometimes it means just going by and giving somebody a hug, for real. So through that, we distribute sterile supplies, clean cookers, cottons, waters, tourniquets, and Neosporin, care package things. It's been one of the programs that we started where we never had to question how effective it would be because we already knew. We don't have a whole lot of actual data to support like the positive outcomes from it. We're waiting to see what happens in legislation this session. We're hoping that it passes all of its committees before we can really start collecting like hard data on it. But we have definitely taken out more syringes than anybody has gotten. And we have been able to provide trainings and safety education to a lot of our community providers who do housing first models, which I don't know if you guys have housing first here, Goodwill. Does Goodwill do it here? So we did a lot of trainings for harm reduction, naloxone, syringe exchange, safe disposal techniques for housing first programs who had a lot of issues with that stuff, which cut down on the amount of calls that had to be received from Housing First from the police department to show up at the Housing First complex because of syringes that were just scattered everywhere or people not taking precautions that they really should.
Are you working with the veterans associations over there? Because you're probably finding that a lot of them are veterans, self-medicating veterans.
I don't know. We're not working with the Veterans Association directly as far as, I'm sure that there's been referrals back and forth. Most of our population, I don't know what what percentage is veterans.
We have a very, very low percentage of our population are veterans.
Because they have built-in services.
The VA Center in Palm Beach County, they have a lot of services there.
It's like 5 miles from us, the
Yeah.
Veterans Center.
Yeah, and
But-
they have like their own housing system and stuff like that.
All the services we have, they provide as a part of the VA system already.
And they have peer supports within the VA system.
So we're able to just make a referral where it's easiest for them to get access through their own system as opposed to trying to, we just offer, for a lot of folks like that, we offer as like a backup. If they're a specialized population who have a system that exists already, then we tell them, hey, the best thing for you to do is go through this system. Call me if it takes too long or you can't get in that way, then call me. At least we have another door in.
Yeah, that's what we do. We provide the linkage to care if somebody came in, and that's one of our questions on the admin that we do, is if they are a veteran, and then we would automatically go and link them to the services that they needed through the VA.
That's my COO. She's not just some random lady for crack. And they're the ones who are refusing to do drugs after they test it. So we've seen a positive impact in that manner that it's not a popular way of saving somebody's life, but it's effective nonetheless. That I paid $100 for a box, and that box saved one person's life. Worth it every time. I will give you $100 to save people's lives as often as I can, right?
So recently, someone proposed that we have Narcans in schools. I'm a school board member.
Absolutely.
And so what, if any, is your connection with the Palm Beach County School District as far as your work?
None except being on a reentry task force with the Palm Beach County School District. It's available to all schools. So we worked a lot with the local colleges and things like that to get their officers to carry. And we try to steer clear of youth just because it's not what we do. but there are school programs that are looking to advocate for that, for naloxone in the school, and it's important because it's important. Remember, a lot of people look at putting naloxone in elementary school and they're like, they get angry, like, why would elementary kids need that? Remember that opiates don't care if you meant to take them or not. Yo, my 3-year-old gets into everything. I put these toys on a shelf that is 7 foot up, right? And I was like, hey man, every time you do something kind, I'm gonna give you one of them toys. If you go to bed and you're sweet and kind and you don't fight me, you can get one of them Transformers. And then I heard Transformers hitting the ground. And I was like, what is that? And I walked in and my kid is stacked up like a Lightning McQueen car on top of a Lego box and climbed up and he's on the shelf sweeping all of them down with his hand. You know what I mean? Naloxone simply does what it does. There's no population that it's inherently meant for. It's meant for people who are experiencing an opiate overdose. It doesn't matter whether they got there illicitly or through accidentally taking their parents' medication or saw something they thought was candy and took it to school and their friends took it. It doesn't matter. A Percocet looks a lot like Pez. I know because I used to eat them out of a Pez dispenser. But it's not something that's a far leap to make, especially when I was growing up, they had morphine lollipops. And I had a friend named Kira who died at 17 because somebody gave her a lollipop she didn't know had morphine in it. 17 years old. Never did drugs, hated them. Had somebody at the school had naloxone, she would be here, right? She would have had a chance to see out her life. We can't allow what our preconceived notions, again, to determine the actions that we're going to take to keep our kids safe. I don't care how it got into my kid's school. I want my kid to be protected. That's your job. I'm trusting you with my child, and if there is any real significant danger, right, that this might happen at our school, then we should protect against it. Simple common sense, right? A shooting happened in Broward County at a high school, and they were like, we're going to arm teachers. A shooting hasn't happened here, but we're arming teachers, right? If we put guns in schools, I'm pretty sure, and I'm not trying to be political, I'm just saying, common sense dictates, if I put a gun in school, I should be able to put naloxone in the school without people causing an uproar. Like, don't be concerned about this medication that, by the way, has zero negative effects on you. It has zero effect on you whatsoever if you're not using opiates. I could dose myself right now and nothing would happen. There's no lethal dose. You can't overdose somebody on it. It's one of the safest pharmaceutical medications there is. I have boxes of it all over my house, and my kid plays with it all the time because I know he ain't going to get hurt. Nothing will happen. But if you could put guns and bullets in schools, I think you can put naloxone in schools fairly safely. Right? One will kill you, one will do nothing. Leave a bad taste in your mouth. I feel like I upset y'all.
Everybody please join me in thanking Justin for being here today, and the CEO. Before we conclude, I want to say a couple things first. There was forms that were given out today. Obviously, it was mentioned by myself and Justin mentioned it's so important to identify the resources we have in the area. So if you have the form, you haven't turned in yet, please turn the form in up front. If you have other organizations that you know about that could not be here today, please ask for a form and get that to us. Once we put the resources together, I promise you, we'll have everybody's contact information after today. We will reach out to you to have further meetings and contacts, talk about what's our next step. Again, I want to thank you for being here today. Take the time out to be here because I know it's important to all of us in this room or you would not be here. So thank you so much for coming. We will be in contact. Thank you.